Uh, Welcome to part 3 of our webinar series, Implementing Effective Substance Use Disorder Treatment in Regional and County Correctional Facilities. We're delighted that you could join us this morning, and we're going to get started here at the top of the hour to keep things on track in a timely manner. Just recently this morning, we've sent you a revised agenda. We've had a few substitutions on the team. So we'll be talking about that in a minute, but we're delighted to welcome all of you, our speakers, our technical support, and staff to session 3. If you would take a moment to share participant information, there is a link in the chat that just gets some basic information about who you are and who you work for, and we'd appreciate your taking a moment to complete that. So in our first 2 sessions, which are available, the recordings and the handouts are available on our website. You can, we endeavored to answer the questions, why do we need to do this? And how do we do it? The nuts and bolts of implementing both medication for addiction treatment as well as recovery support services, treatment services, with examples from Fairfax County and Chesterfield County. Today, we're going to be really working to help answer the question, how are we going to pay for it? And what are some resources that can help us to get started or to enhance what we already have in place? So we'll have questions to be answered, hopefully, at the end of each speaker session. And we'll be taking a break around 10:15, something like that, after our first speaker concludes and has answered all your questions. So again, thank you for joining us. And our first speaker today is Charlie Lindekum. He is currently the Director of Operations for the Virginia Opioid Abatement Authority. We're delighted that Virginia Opioid Abatement Authority co-sponsored this presentation and help to make it available throughout the state of Virginia. Charlie oversees the entire life cycle of grant awards made by the Office of the Opioid Abatement Authority, as well as the outreach to Virginia city and county officials. So he's a good man to know, and we're delighted to welcome Charlie here today to kick off our webinar series this morning. Charlie?
Thank you, Donna. Thanks for bringing us into this event and the whole series here. It seems to be well attended and getting some good traction, trying to get all the information pushed forward here. So let me do my share and see if this all works or not. Got the slide deck up?
Yep.
Awesome. All right. Well, as Donna mentioned, I'm Charlie Lindekum, Director of Operations for the Opioid Abatement Authority, subbing in for Tony McDowell, our Executive Director, who had a family issue to attend to. So, we work in tandem all the time. We are right now a small team of 6 full-time employees. We're going to have a big expansion next month to 7, and that's probably about it. We're working on some additional part-time staff that'll be based regionally to additionally help with outreach and whatnot. So I'm going to talk about potential vehicles for funding, or new funding or expanding funding for all these different types of solutions that you've been hearing about over the last couple of sessions. So the money that comes to the Opioid Abatement Authority is coming from litigation cases against opioid manufacturers, distributors, retailers, marketers, anybody that's in the pipeline of between making them and putting them in, to people's hands, is involved in this. And there was at one point, there was about 3,000 cases nationwide between cities and counties and states. And lots of other governmental entities and things that were suing all these companies, and they all got remanded up to federal court, and they got together because nobody wanted to deal with 3,000 cases of much the same subject. And so they in 2017 they were put into what's called a multi-district litigation, or MDL, in the Northern District of Ohio. People ask me why Ohio. I still don't know. It might have just been that he was the next person up to get one of these things, but that's the judge you see there is the one who's been overseeing all of these, and he basically told all the companies, I've looked at these some cases. You better work on settling. You don't want to take this to trial with me. Um, and so what has resulted in this is something that, so those of you familiar with the tobacco settlements that started up in the late 90s, early 2000s, and still going on today, those were much larger in funding. But while these opioid settlements are not as large, they are the most complex settlements. And that in comparison with the tobacco. And you'll hear me mention that once or twice. Many of the approaches Virginia has taken along with its settlement and some of the general national settlements is from lessons learned from the tobacco settlements. So how did Virginia deal with these national settlements? Well, basically, once something is kind of a company has kind of reached the status of getting into these national settlements, Virginia has to come in and see how many cities and counties want to participate in this settlement. So luckily for Virginia, we got all 133 cities and counties to participate, which means they, as well as the state, had to give up their own cases so that everything could be kind of combined into this one case, and that they also wouldn't come and try again to sue for the same thing. So by getting all of the localities, we got additional financial incentives. There are some states that don't even have 50% of their localities signed on with the state as a whole. So what came out of this was the Virginia Opioid Abatement Fund, which is what we administer. I'm going to talk a little more about that in a minute, and a statewide allocation memorandum of understanding. And this was negotiated between the representatives of the local governments and the Office of the Attorney General, who was kind of the lead on the case, and lots of input from various interest groups. It establishes the method and formulas for fund distributions. It helps establish the Opioid Abatement Authority, its composition and duties, and the allowable uses and requirements for funds distributed by the OAA. And then also in 2021, the General Assembly passed a law in Chapter 22 that basically created in law the same things that exist in the allocation MOU. And what happens is once we get everybody is signed on to one of the settlements for one of the companies and everything is done, the allocation MOU, the Code of Virginia, the court orders, and everything gets wrapped up into one court order in Richmond Circuit Court, which means if anything falls out of compliance with any of those bits, there's the potential chance that the case could be reopened and be relitigated by either side. But specifically, like if Virginia was not to be compliant with the terms of the MOU and the settlements, the companies that are settling companies could come back and try and reduce their payments due to noncompliance. So the court order brings all this stuff together. And one thing that is both good and bad, that means it's very hard to change the Code of Virginia that oversees this and oversees how the Opioid Abatement Authority operates and how the grants are dealt with and that kind of thing, because it's also tied up in this court order. And while the General Assembly certainly has the power to change the laws around this, doing so could be considered in violation of the court order, which means it keeps, potential politics from potentially playing with what's there, but also means it's harder for us to adjust things than most groups in this type of situation. So also the law created the board of directors that oversees the Opioid Abatement Authority. So we're an independent entity. We are not part of the executive branch or the legislative branch or the Attorney General's office or anything like that. So we're an independent state agency. We are state employees, but we are not subject to the state's procurement laws, the Personnel Act, and the VITA information technology oversight. And so we have a board that hires Tony, who's our executive director, who hires the staff. But the board is specifically spelled out about who can be on the board. And you can see on the left here, all of our different members. We have to have someone from, and everyone except for Senator Pillion and where is this? And Delegate Ballard, who are the representatives from of the finance committees from the House and the Senate. Everyone else is appointed by the governor. However, they have to meet certain qualifications to be able to be appointed. And so, like, you have to have elected member of a local governing body. That is a Jim Holland from Chesterfield County, who also serves as our treasurer, a representative from an urban and a rural CSB. So we have one from Piedmont CSB and one from Fairfax CSB, licensed practicing city or county attorney from Roanoke, who also serves as our secretary, two medical professionals who have expertise in behavioral health and opioid use disorder. We have Dr. Thomason, who's our vice chair, and Dr. Thompson, who also serve in those roles as like addiction medicine specialist and someone from the recovery community. Mike Tillum, there's also sheriff, and then and from an ex officio standpoint, the Health and Human Resources Secretary also serves, or his designee serves on the board. And even for another step, like to get the people from the community service boards, the Association of Community Service Boards will say, here's 3 people from rural and 3 people from urban that the governor can choose from. The Virginia Association of Counties says, here's 3 elected members you can choose from. So it all comes from the organizations that oversee this, and they're looking for the most qualified people to be on here. So we don't have a lot of like political appointees and that kind of thing. I should say politically driven appointees. So what is the OAA doing in big steps? So we've concluded 2 city, county, and state agency grant application periods, awarding about $34 million in settlement funds. We also recently had another round close on April 1st, and we're working through about 90 applications for funding right now. Our board conducted 7 listening sessions throughout various locations of the state. Last year, we did 14 Abatement Academy free webinars. And then we also did 2 in-person workshops related to that. Held lots and lots of informational webinars, some of which are posted to our website. We've been presented at basically any conference and association meeting around the state that will let us talk about the types of things that can be done with the funds that we have. And our city county grant period usually runs from October 1st to April 1st of each year. So here you see a representation of logos of all the kind of current cases that are somewhere in process of being finalized or starting to pay out over a certain amount of time from these different settlements. On the left, you see the distributors who all negotiated together in one settlement. And actually, since this was done, AmerisourceBergen has changed their name to something else. And Janssen, which is a subsidiary of J&J or Johnson & Johnson, those are the kind of the first 2 to get going and are actively paying out on a yearly basis right now. CVS, Walmart, Walgreens, Teva, and Allergan, so kind of this group here, just got finalized and have just started paying out stuff directly to cities and counties. So much so that we haven't even been able to update our lookup tool for them yet, because we were just getting finalized numbers from the Attorney General's office to do so. Kroger is also in process, but they're a little further behind these other ones, and they will probably be done towards the latter part of this calendar year. And then you got these Purdue, Mallinckrodt, and Indo over here. They've all been dealing with bankruptcy issues. Mallinckrodt was in bankruptcy, came out, finished their settlement, went back into bankruptcy, came out with a much lower number for their settlement, and have actually completed. Indo is still in bankruptcy. Purdue, that's the Sackler family you may be familiar with. There are some items around the ability of settling and through the bankruptcy court for these settlements, and allowing the Sacklers to not be able to be criminally prosecuted if they agree to the settlement, that are sitting at the Supreme Court. And we assume at this point we'll probably hear something in June as all their cases are starting to come out. So this is what we're looking at. The longest of all these settlements pays out over 18 years, and the other ones are somewhere in the middle of that. So we're looking at funding in various amounts coming, starting in 2023 and going through at least 2039, maybe even to 2042. We're projecting to get 1.1 billion in Virginia across all of these settlements. And 55% of that is directed towards the OAA and it's deposited into our opioid abatement fund. So this is kind of a picture of what we know. What we know when the slide deck was put together is things tweak a little bit here and there. You can see these ones that are finalized that I was just mentioning. The ones that are these 5 here were pending, and I don't think they literally just started paying out like maybe last week or this week. And then there's some of the other ones that have been announced. You can see how big this one with the 3 distributors is compared to everything else. There may be additional cases that come through, but none of them will be as large as some of these earlier ones. They'll probably be more in like the millions or the low tens or teens of millions, which when distributed across the state is not as big of a needle as most of these other settlements are. Well, one important thing to note, as I mentioned, the money comes in kind of odd ways. As you can see, it goes, the blue line here kind of goes up and down, and you can see how we've kind of made some budgeting amounts to make everything right. And part of the reason we like to show this is there's a lot of front-loaded money. But just because you see money available in the first couple of years doesn't mean we have that same amount of money available for 18 years. It's not like a flat settlement payment per year. So the money drops significantly after the first couple of years as far as how much is coming in. Some of them have paid up front and then aren't paying for a few years, which is why you see some of these kind of swells and going up and down. But overall, in the grand scheme of things, the amount of money that we have available each year goes down a little bit. We've done some long-term budgeting to try and based on projections to try and smooth out money that's available where we can, so that we're not offering $25 million for grants one year and then $2 million in the second year. It's where nobody has enough money to continue projects. But that is an important thing to know, that if you're thinking about using this as a funding vehicle, submitting projects where the funds that you're requesting from the OAA increase year over year is going to be hard for us to fund. Looking at other matching grants or items that you can pull in and braid some funding together will be a more successful application. So you guys will get the slide. There's a lot of different stuff here about where we are and where we expect to be over the next kind of 10 years or so. So how can these monies be used? Well, each settlement is slightly different from the others. No 2 are the same. No 3 are very, very different, but numbers are slightly off, and there's some things that can be confusing. Some of the settlements will say 85% of the funds must be used for approved abatement uses. Some say 86, some say 100. That 85 and 86 can be a misnomer because there's some money already in that's baked into that number that's set aside for like recovering attorney fees and costs. So we have to be very careful about any non-abatement uses. They are considered disfavored in the settlements. Disfavored is not defined. And so there's a lot of documents. Each one of these things are about 600 pages that offer a lot of information. But when you come down to actually administering something and trying to make sure you're staying on the right side of the line, there's not a lot of clarity. And so there's various rules about past spending, supplanting, enforcement and reporting is not always clear. And then you have to go to court to resolve things. And there's the risk in Virginia is shared by the state and all the localities because we're all together on this in one big thing. But there is an Exhibit E that talks about a list of approved uses. So what does the money look like when it gets to Virginia? If you look here with the big pie chart here, there's three buckets. 15% of every settlement that Virginia signs on to goes into what we call the Commonwealth share. That goes into a special fund called the Commonwealth Opioid Abatement and Remediation Fund that has to be used for opioid abatement purposes. That gets dealt with by the governor and the General Assembly through like the normal appropriation process. Then 30% goes directly to cities and counties. And so when I say some of these settlements have started paying out, that's the big piece that's starting to happen. Localities are already starting to get money for some of these. There's that recent set of 5 retailers. And so this doesn't come through the OAA. This does not come through the Office of the Attorney General. Doesn't come through the state at all. It literally goes from a settlement administrator called Brown Greer, to each city and county. And these part of the allocation for this is broken up on what do we call a measure of harm per capita, which means that the formula doesn't just look at your population. It looks at other things related to the opioid epidemic, like number of overdoses, number of overdose deaths, emergency room visits, amount of MMEs of opioids that were shipped to your particular locality, all kind of things like that to kind of balance out so that, the high population areas that maybe don't have as high level of harm aren't getting overcompensated and the lowers not. So the best way to example this is Fairfax County is about 13% of the population of Virginia. They're getting about 8.5% or so of settlements when these distributions are broken up, whereas Wise County is like 0.4% of the population, and they're getting almost 2% of the settlements because their measure of harm significantly outweighed their population. So from there, 55% comes to us to the Opioid Abatement Authority. This is the Opioid Abatement Fund. And then statutorily, that is broken into 5 categories. So let me click through here. Yep, that's opioid. Yes. And I'll catch you up. So these 4 buckets here are, in the statutes. It's not just stuff that like the OAA or the board of directors has made up. So 15% of our funds have to be set aside for each city and county under the same, what's the word I'm looking for? The same allocation percentage with that measure of harm per capita as is done for the 30% direct. So we look at these as kind of entitlement funds for each city and county. They just have to meet certain standards for us to be able to distribute the money for them. And so I call us we're a speed bump in guardrails to the money for this directly available for cities and counties. We're not trying to be a gatekeeper, just trying to ensure the usage is proper. Then the next section here is a separate bucket of money that's for city and county partnerships. We call these collaborative partnerships because they require multiple cities and counties to work together. And it's an additional bucket of funding that can be applied for. So while this is more of an entitlement funding up here, this is a competitive amount, but we only have a limited amount. And as I said, it goes down each year. However, to help boost scores and help string the money out, cities and counties can use this money here as well as this direct money over here as matching funds on these grants to try and help string things out and let them go further. And it's especially useful in some smaller communities that don't have a higher population or a higher measure of harm per capita. They'll get a lot more bang for their buck by stringing all their money together into one project as match, where we can then provide some additional money from this bucket to help. There's an additional 15% set aside for state agencies, and then there's 35% is considered unrestricted. And what that means is well, for one, it funds the operations of the Opioid Abatement Authority, but otherwise it allows the board to be creative and come up with different ways to add funding to these kind of 3 buckets for additional projects. And so we've done some planning grants for localities that having trouble figuring out how to get started in this space. It also funds what we call our gold standard incentive program for localities. It helps boost some money that's available here if they agree to treat their direct money the way they have to treat this money with some additional things. But one of the other things to note, the OAA can only give grants to cities, counties, and state agencies. Various other groups can partner with them. Sheriff's office, partner with the city or county. Community service board, partner with the city or county, or the group of cities and counties. Commonwealth's attorneys, anyone, school districts, all those groups would basically be be able to be a subrecipient and like a partner in one of these grants, but they cannot apply directly. It has to come from the city or the county or the state agency. They are the fiscal agent. They are the party of the to the lawsuit. They're the ones that are signed onto the agreement. Towns are not eligible as well to directly apply. They are considered subdivisions of counties, whereas this lawsuit is for the state and its subdivisions. So, but they want to can partner with their county. And so, what are the requirements around funding for these settlements? Like, what do you have to do in a program to be able to have funding from these settlements? So, when it comes from the OAA, 100% of the funds have to be spent on abatement efforts. What does that mean? That means not buying police cruisers, not paving potholes, not replacing park equipment, not paying off debt, but adding to or expanding programs or creating programs that are specifically to help save people's lives that are affected by this epidemic, whether it's prevention, treatment, recovery, helping people that are justice involved, like many of you do, or any other number of options there, harm reduction, those types of things. There's no reimbursement of previous costs and no supplanting allowed. Supplanting is when you basically would take one set of funds, like a grant fund, and put it onto something that has been funded by your city or county's regular general funds and appropriation. So if you needed someone to help manage a program, and there was a position that had been in existence for 50 years, and fully funded by the county government for those 50 years and appropriated, and you just wanted to take 10% of these abatement funds to pay for their responsibilities overseeing some of the accounting for this, that'd be considered supplanting, because that position would exist regardless of this and has been appropriated. So that is not allowed. There is some flexibility around things that are currently maybe grant funded for grants that are ending or being reduced. If you have questions on that, please reach out to us. But we have to be very careful with this type of thing. Differently, though, something that is not supplanting would be if you had a wage employee who was working 20 hours a week and you wanted to increase them to 30 hours a week, and those additional 10 hours were going to be spent on settlement work, that's fine. Or increasing the hours of a contractor, bringing on a new employer, a new contract, those things are all allowed. It's just about the things that are currently funded. Also, no indirect charges are allowed. So no taking 10% off the top for the cost of procurement and operations and things like that. And right now, the indirect charges, it applies to the recipient, the city or county. There's a little more flexibility when it comes to a subrecipient because they are not parties to the lawsuit. And on an annual basis, at minimum, I have to report on outcomes and allow us to monitor the programs. So examples of items that are likely to qualify as abatement: prevention programs in schools, detox services, including opioid-related detoxification, naloxone, purchase, training, distribution, treatment services, including medication for opioid use disorders, programs to divert people from jail to treatment, including drug or recovery courts, recovery housing, transportation, job training, employment, crisis programs. There's lots of different things that can be linked here. And even if you are in an area where you're not seeing as much opioids because they're harder to get, but you're seeing more stimulant use disorders. One of the things that the code allows for is that the funds are supposed to be used for helping people with like opioid use disorder and or co-occurring substance use disorders and or co-occurring mental health issues, because anyone who's got any type of substance use disorder or mental health disorder is at a higher risk of developing opioid use disorder. So if they're in treatment for a stimulant use disorder, they're at risk for opioid use disorder. And most programs have prevention stuff to keep people from sliding into a different substance. So either people are getting treated for opioid use disorder or they're getting prevention materials for opioid use disorder in a treatment program. Now 100% of people are getting opioid abatement in some frame. So there's some different ways we can couch this to make the funds work, and understanding that you don't have to segregate every single person that comes in, and if off the old, we can't use this money for them because they don't have opioid use disorder as a primary diagnosis. So I talked about our grants a bit. So apologies if I'm feeling like I'm bouncing around a little bit. I just picked this up from Tony just the other day, and these are his slides. So I haven't had a chance to review them in order many times as I would have liked. But those are the individual ones. Each city or county has a specific amount of funding. They're not competitive. You have to follow the settlement requirements. You have to submit an application and agree to terms and conditions. These applications have to be for specific projects, not just, oh, we're going to do here, give me $100,000 and we'll do some opioid abatement programs. No, it needs to be like, we're going to add MOUD to our local jail, or we're going to increase the staffing for our recovery program in our jail, things like that. And right now, the application period for these had closed. It closed April 1st, but we will open up again on October 1st, and we have a 6-month period through which we accept applications. Again, the cooperative partnerships I mentioned are competitive. Must include at least 2 cities and or counties that need to be in the same behavioral health region on the project. After you meet that minimum requirement, you can add as many others from wherever in the state as you want, but the code requires that at least 2 cities and or counties be involved from the same DBHDS region. One of the cities or counties has to be the fiscal agent, and that's who we deal with. And then for anything that has to come from the other cities and counties, that is dealt with by the fiscal agent. Applications, terms and conditions, again, they have to be specific, where there are certain things that we have to prioritize based on things that are in the code that help us score our applications. They're accepted during the applications are accepted during the same time frame for these. So what does this prioritization look like? The geographical distribution across the behavioral health regions of how the funds are being used, the harm per capita measure that I mentioned. We look at communities that have they're economically disadvantaged, which looks at poverty as well as race components. And those get opioid use disorder programs that are in those areas get a higher score than the ones that are not. We look for programs that are run by organizations with a record of success, that use efforts that are evidence-based or evidence-informed, and then having an actual cash match. And the higher the match, the higher the score. There's no requirement for a match on any of these, and there is no like minimum percentage if you're going to do it. But it's if you have a match, it helps increase your score over a like project that does not have one. And a little bit more about the match. It has to be cash, cannot be in-kind services. We looked at trying to figure out how to do that, and the code really just says in-kind is not cash. It needs to be actual money, whether it's money coming from a grant, it's the direct distributions, individual distributions, general funds. It can be things that are donated on behalf of a city or county. It could come from like a hospital system or a philanthropic organization. There's lots of options there. As I mentioned, these two, the individual as well as the gold standard funds can be used as a match. Again, we also do things for state agencies. This process is a little bit different. It's based on a request for proposal that results in an MOU that is an award for processes to be done. And one of the things is they can't create like a long-term, these projects for state agencies can't create long-term liabilities for the Commonwealth. They have a different period they run from in the spring, usually like mid-March to mid to late May, and they run on a different performance period. They run October to 1st to September 30th. All our city and county grants run on the state fiscal year. I mentioned earlier about some of the special grants, additional funds beyond the minimum percentages from the board's discretion. They talked about the individual and regional planning grants and then that gold standard money. This is a kind of a chart look at how the money ended up distributed from our first round of regional grants that we did last year, as well as individual grants. You can see we put out about $23 million, and that's how it kind of broke up. We had a lot of stuff come from the Southwest region, but they have such a high measure of harm per capita. They also have more money available than some of the other regions. This is what our kind of list of our state agencies that got awarded last year. So a lot of money went to the Department of Health. Some of that, some one-time funding for things like naloxone purchase and things, as well as we had some one-time funding going to Healthy Youth and the Department of Corrections. But we have a number of great projects going on with them. One that could be a particular interest to those of you in the corrections is we are working with the Department of Corrections on a pilot program to test the long-term benefits of moving from an oral, opioid agonist that to a injectable that would be, instead of being given like once a day or once a week, where someone has to sit with them to try and prevent diversion, which can still even happen after they leave. This is an injectable that's done once a month. It's a much higher cost up front, but we believe that there may be a savings on the back end, as well as a much increased, reduced diversion and increased success. So they're going to provide a report out because it's expensive to do. We wouldn't be able to fund it in whole. It would eat up more money than we have available for state agencies, but look for some information on that hopefully in the next year or so. So examples of various city and county projects that we have awarded. Roanoke City had 4 projects that were for fiscal year 24. They do an adverse childhood experience training with their summer and after school program centers. They hired a peer recovery specialist for the sheriff's office and adult detention center. Xylazine test strips and spectrometer for harm reduction and prevention efforts, and a marketing campaign for their warm line, and bought some naloxone and did training for their fire and EMS. And that's just an individual. That's just that 15% of our funds that's set aside. That's Roanoke's portion of that 15%. So you can make a bit of money stretch it a long way with some of these programs. Excuse me. Albemarle County worked with their as the fiscal agent. This is a cooperative project, and these other counties are all in their community service board, who they've contracted with to kind of lead the execution of the project. So they have a crisis intervention team assessment center, and they expanded their crisis response with a 23-hour bed program, and they also had another program that was based around community outreach. Grayson County down towards the southwest. They're enhancing their recovery court with these funds. Hanover County is leading a project to expand Project Recover, add Hanover and add capacity in Chesterfield and Richmond, which embeds certified peers with first responders to connect people who overdose to resources. So it's almost like you have a peer doing case management, trying to catch people while they're at their most vulnerable and most likely to engage in treatment and recovery, and following up with them, making sure they're doing everything that they need to do, and try to provide them as many supports as can be to keep them on that track. Rockingham County and the city of Harrisonburg are doing a planning grant that's using a cross-system sequential intercept mapping to bring together their stakeholders and identify resources and gaps in services at each entry point to the criminal justice system to help them figure out what are the next steps they need to take to help their population. Additionally, with Fairfax County, they have a grant to add capacity for young adults to their drug court. On a few of our state agency projects, the Department of Health expanding the naloxone distribution system, did just a large purchase of naloxone, expansion of certified harm reduction sites, and adding opioid abatement specialist positions to three urban health districts to help kind of consolidate all the work that's done around there and have better results in those programs. Our Department of Corrections, I mentioned the pilot program on the long-acting injectable opioid agonist. They've also added clinical social workers who specialize in opioid use disorder to help those that are in treatment. There seems to be a better chance of longer-term success into recovery when they have those people to engage with them. They're also doing an education and prevention video for inmates for the different options that they offer for those with substance use disorder. And the Virginia Foundation for Healthy Youth is doing a large prevention and education campaign specifically aimed at youth and young adults around opioids. The Office of the Executive Secretary, the Supreme Court, has developed a statewide best practices drug testing for alternative dockets and provide some local financial assistance for setting up this best practice in drug testing. So they're kind of taking our grant, our award, and then creating a grant from that for localities. The Office of the Attorney General, you may have seen this. They're launching an opioid and fentanyl public information campaign centered around One Pill Can Kill. And Virginia Commonwealth University has two projects. One is they're creating a technical resource toolkit for cities and counties in Virginia that will highlight programs that are already being used in Virginia that qualify as like an opioid abatement type of program, kind of like some of the things that you've heard from like Fairfax and Chesterfield, those types of things. And they'll also be able to have vendors who want to be kind of included, have their programs evaluated as this meets an evidence-based standard for these types of programs. They're also developing some protocols and pain management for cancer patients in palliative care settings to help them if they have survivorship, they've survived the cancer, but now they have an opioid use disorder. And how do we prevent that from happening, or how do we help them step down to get away from that or get to lower, more manageable medication? One other note is that we through all of our work, we have tried to couch it around these nationally accepted principles for use of opioid funds that was developed by a consortium of about 60 organizations all across the spectrum of abatement, and it was led by the Johns Hopkins Bloomberg School of Public Health. For the third quarter of last year, we actually won their award of excellence for the application of these principles through various parts of our efforts. So there's Tony's contact information, but we can make sure that you have mine as well. And we're happy at any point in the year to have conversations with people that are interested in this. If you want to have something more detailed than what we can maybe accomplish today, we also come out and meet with groups of people and try to help talk about what you can and can't do and help people work through figuring out what it is they need to do to try and get something going. So that ends my slide deck. I guess we're at a point of going to questions.
Thank you, Charlie. We do have some questions. What percentage of cities and counties eligible for funding have applied for it?
It's a good question. I don't know, primarily because we're still sorting through the 90 some applications we got just at the beginning of this month. it's hard. It's hard for me to say. I would say off the top of my head, I think we're at least at 50%, perhaps more. Some have applied to be part of a program, like a regional program, but have not necessarily put any like matching funds in with that or applied for their own funds directly. So they're part of a they're part of a grant, but they're not pulling any of their own money in at this time. So and some of them are the money they get directly they can use on their own without coming through us. There's some localities that have done that but haven't moved to applying for funds for us. So there's some usage happening that is not necessarily reflected just in our applications. So I'll add that up at some point. But yeah, I haven't had a chance to sort through everybody yet.
Thank you. Do the funds have to be returned to the OAA if not fully exhausted?
So there's a couple of options there. We do have a process for carry forward. One of the things I should mention is any of our applications that come in, they get worked by staff. We work with the applicants to make sure we understand what their request is, and we have all the details we need. And then we create recommendations that go to our grants committee, which is a subset of members of our board. So they make the decisions for the awards. They authorize them, and they authorize any amendments or renewals or carry forward each year. That's all done in public meetings as well. That almost always have a virtual option and public comment period. So it's possible the funds can be carried forward depending on what they would be used for. If there was no possible use for them, then they would be returned. And then when that comes to like those allocations for like each specific city and county, if they get returned to us because like a project has ended or they don't have another use for it, they just go back into that city or county's bucket. The cooperative funds would just go back into the overall cooperative bucket that would be available for the next round.
Okay. And can direct care agencies that work with OUD peers receive funding?
They certainly can, but they would have to work with like a city or county as who would have to be the applicant. And if that's a private entity, there may be some procurement process that the city or county would have to follow. We don't prescribe procurement processes, but there's nothing of our grants that would help exempt them from the state's procurement process or their own local procurement procedures. But the city or county can work with anybody they want to execute a program. It just depends on how they want to, kind of develop it and how they want to manage it. But we don't prescribe that you can't work with, this group or that group, as long as the project and the end results of the project are able to match out to performance measures that you have to choose as part of the application process. And those are getting towards an opioid abatement purpose in the focus. The rest of it it's designed to give the localities the flexibility to do what they need to do for their community, which for those of you public administration students is very interesting for a Dillon rule state that mostly just tells localities what they can do, not what they can't. But this is solutions are going to happen locally, and what Fairfax needs is not what Roanoke needs, it's not what Norfolk needs, it's not what Petersburg needs, it's not what Franklin County needs, it's not what Wise County needs, and what is needed now may not be what's needed in 5 years. And local governments can pivot much faster than the state, much less the feds, to be able to kind of keep responding to the ecosystem of issues. So,
thank you. We have a few more minutes. If someone has questions, if you just put it in the chat, we'd be happy to cover those for you.
Hi, Marlene, this is Donna, and I didn't introduce you, so I wanted to. Marlene Crawley is the project manager for Bay Rivers Telehealth Alliance, working with the Rappahannock Community College on our rural community opioid response program grants. So we're delighted to have Marlene here to facilitate the Q&A. I actually had a couple questions I wanted to ask, and being a host of the event, I can't use the Q&A, so I just decided to come on live and ask directly. I am actually an executive consultant to Bay Rivers Telehealth Alliance on this project and some others. And one of my interests is grant resource development. Bay Rivers Telehealth Alliance has done a lot of collaborative grant making. I'll be talking about that a little bit later. So a couple of my questions have to do with how to write the grants. I know that it's only cities and counties that can write those grants. One of the things you mentioned, Charlie, was that you do not support indirect charges. And I just want to get some clarification about that. You're saying like a line item that's just general, that's 10% indirect for cities and counties is not supported. But do you support any of the administrative expenses like staffing, supervision, rent or utilities, specific expenses that are utilized for the opioid abatement activities?
Yeah. So minor point of clarity I probably didn't make earlier. The city or the county or state agency has to be the applicant. They have to sign their, like the city or county administrator, manager, whoever, or their designee has to sign the application. That does not mean they have to necessarily write it. That's up to them. There are a number of applications we've got where like a nonprofit is basic or a community foundation has kind of taken the lead. They've done all the legwork. Then they go and review it with the city or county or the group that about what they're applying to. They get their buy-in and sign off, and then it comes in. City and county still has to manage the funds. They have to oversee the program. But that heavy grant writing doesn't necessarily have to happen. I'm not going to say, oh, I can't accept this because the CSB wrote it and you signed it. It's incumbent on the city, the leadership of the cities and counties to make sure that what's they're signing, is working and they have the money available for anything they're requesting. But that is one thing that other groups can do the bulk of the legwork. And I'll say, if you're part of not a city or county and you think you might have the capacity to help, you may be doing some of them a favor by taking on some of that work for them, as far as getting all the nuts and bolts done and the I's dotted and the T's crossed. As far as indirect charges, so that's in the statute that we cannot award funds for indirect charges. The way we've currently defined that is that applies to the city and the counties and the state agencies as they are the recipient. The next level down of subrecipients, those are not parties to the lawsuit. So nonprofits and jails and regional jails and sheriff's offices and all that kind of stuff, those are not CSBs. Those are not parties to the lawsuit. So we have allowed indirect costs to come through there. As far as administrative costs, we look at it at allowable administrative cost as new administrative costs, because that comes back to the partly to the supplanting thing. So if you have a building, let's say like that you are going to expand into the space next door to create a crisis receiving center, then your increase in rent for that new space would be allowable. If you're bringing on a grants manager to just oversee these things, part-time, full-time, you're contracting with a grants expert to help you oversee this stuff. That's a new cost. That's fine. Much like when I talked about the supplanting, if you're increasing hours of contractors or wage employees to specifically work on these projects, those we consider new costs. That's where we look at allowable administrative costs. If you've had the same building for 30 years that's funded by the county or the city to pay your rent, even though it may go up, and you're just got some space and you're just going to use that space that you're not some part of it that you're not using, then to pay part for the opioid abatement funds to pay part of that rent is kind of gets towards the supplanting piece. So there's a lot of if-then type of scenarios in there. It depends on what the funding stream was, who's paying for it, who owns the facility, who's responsible for this. So if you've got some questions, those are the types of things to reach out to us for and let us help you talk through, because it may be, if you go down this path, it's a no, but if you go down this path, it might be a yes. And we also do draft reviews of all the applications, be they early in the process, middle. We have a deadline for drafts before the final due dates, but even for the competitives, I know for any of the competitives, we will look at it and basically tell you, here's some advice we have of how you could strengthen this. Here's some things you need to fix that would be or that will keep you from being able to go forward. Here's some things that are non-starter that you can't do. And we're happy to get every application up to the point to be at its best level of consideration possible. There's no guarantee that it gets funded in full or in part or at all, because that has to be brought in with everything else for the competitive grants. But we want everybody to be successful in these things. We want to get this money out there to help save people's lives at whatever juncture that it is. So we are willing to help anybody that is interested in trying to get there. And there are some people that I have spent countless hours on webinars with trying to get things correct on big complex projects. And I'm happy. And there's some that I get an application. Go, geez, I wish you'd have called me 2 weeks ago. We could have made this a lot easier ourselves. So.
Hey, thank you. The other question that came up for me was around the cash match. You mentioned it's not in kind, but can be donated items that I think you
Can be donated money, donated cash.
donated cash. Okay, so for example, if we need an office for our outreach person and we would otherwise have to pay rent to get that office and somebody gives us that space, is that considered cash or in kind?
That would be in kind.
Okay,
If somebody gave you cash to pay for adding an office, in the space next door to you, to pay for that would be cash. That would be a match.
so it has to be
But
money, cash coming into
you
your,
need to be able to have it and have it deposited into it deposited into the accounts of the fiscal agent. So,
gotcha.
but it doesn't just have to come from like city or county funds. Like we have one regional grant where the match is actually coming from the community service board. We have some where they've gotten like federal grants to fund part of it, and they're using our money to fund part of it, and they're putting some general fund in. We have some where some various community foundations have given money in to support it, and then even with the contingent of, well, if you will apply for if you'll agree to do the gold standard, we'll give you X month more as a match on top of this initial group. So it can be on behalf of the city or county. It doesn't have to be directly from their coffers necessarily, but it does have to be cash.
Charlie,
But that, real quick, to say, don't just eliminate any, inclusion of any in-kind services. We look at that as additional support. And so whether you've got like a list of in-kind services or you've got like letters of support that detail those, include those in the package, because that helps strengthen the application overall. There's a project in the Shenandoah Valley that we got that had 33 letters of support. They had a 42% cash match, but they had a whole lot more in kind that came from the community that shows this is a community supported project. So that told us that the community's not going to come out and rally against this project. They want it in their backyard type of thing. So it is a good supporting documentation. We just can't add it into that match percentage.
Thanks so much, Charlie.
Charlie, are you able to share some of the biggest lessons learned reported from localities from the first round of funds?
Let's see. Well, we've been on our end running, fast and hot. We opened our offices in November of 22. I had 55 working days from the day I started till the day we launched our first round of grants in January of 23. And we've done a couple other rounds of that in the last kind of year and a half type of thing. So some of it is there's stuff that we could have communicated better that we're constantly trying to do to help the localities. Different ways we could have said things, different when we've actually changed and reduced some of our requirements on this next round to make things easier and whatnot. I think one of the biggest lessons is I don't think people, especially if it wasn't the city or county who was directly doing the application and applying for it with someone else, they're not paying attention to how much funds they actually have available year over year, like in those individual gold standard bucket and direct buckets. And we have a lookup tool for that that shows you what we currently have and what's projected in the out years. And so we would get applications where the match was the same amount of money for 5 years. But I'm like, you don't have those funds. You have those funds in year one, but not year 2, 3, and 4, because you have the payments go down, and not really taking the time to understand how the funding works. It's a bit complex, but we're happy to talk to anybody about it and help explain it and help figure it out and review models and keep things going. I think that's one of the biggest lessons, because we had some stuff that made it all the way through our grants committee approval, that when we got down to then like awarding it out, we're going, oh, wait a minute, they don't have that much money right now. Or we would send them an award package and they'd be like, well, that's not what we asked for. And we're like, it's what we have here, and it's what we put out in the for you guys to review before we gave it to the grants committee. And so I think it's because these are different. This is not federal grants. There's no federal oversight. There's no federal requirements to this stuff. So it's a bit of a different animal, which some people have also struggled with. They keep, well, federal allow. Well, we're not a federal agency. These are not federal funds. They're not taxpayer funds, in a traditional sense. So I think it's just not doing enough reading, paying attention, and asking questions up front, and really ensuring that you've got the finances straight for the money that you're asking for, probably more than anything else.
Thank you. We have one more question. Does a general funds match qualify as cash?
Yes. Mm-hmm. Absolutely. We definitely have some grants that have that.
Thank you. That is all we have in the Q&A at this time. If anyone else has a question, we have a couple more minutes.
I also put in the chat for everyone my email address and my office phone number, since I didn't get a chance to fix them on the slide. That's Tony's, but you're more than welcome to reach out to Tony as well. Or we also have a general mailbox. It's info@voaa.us that all of us can see. And while you may not catch me or Tony, we might get you to someone who can actually help you better than we can, based on what your questions might be.
Thanks so much, Charlie. This has been so informative, and I was just noticing that I could actually give you a hand. I know a lot of people want to thank you for being here. You can't hear the cheers and the roars of the crowd, but we really appreciate your stepping up and stepping in and providing such great information. Thank you so much.
Happy to. Thanks for the opportunity, and thanks for putting these webinars together.
Absolutely. We're going to take a 10-minute break now until about 10:15. And in the meantime, there is a link in the chat that is just a brief informational survey. If you haven't had a chance to tell us who you are and what organization you're with, we'd really appreciate you taking a moment of your break time to complete that link. Thank you, Paris. Paris is our tech guru, helping out from Rappahannock Community College, so we really appreciate her as well. And we'll be back at 10:15 with some really exciting presentations from our friends at the Bureau of Justice Assistance. Thank you so much for being here, and we'll be back shortly. Well, welcome back, everyone. We're really delighted to get on with our third webinar in this series today. very excited to introduce our next two speakers. They came to us through the Rural Community Opioid Response Program, technical assistance provider, JBS International. And just really excited to introduce Michelle White. She's the Senior Policy Advisor. She serves in dual roles as for the Bureau of Justice Assistant, as well as a Senior Program Advisor for the State Justice Institute. And then she recruited Cash Siddiqui, who is here as Senior Director with RULO Strategies. In his role, he oversees training and technical assistance offered to local and regional jails, prisons, community supervision agencies as part of the comprehensive opioid and stimulant substance use program. So we got a 2-for-1 today from the Bureau of Justice Assistance. We're so delighted to welcome you and hear from you. So I'll turn it over to you, Michelle.
Thank you so much, Donna, for having us here. I think, are you all going to be able to share my slides?
Yes.
Great. Okay, beautiful. Thank you so much. Please feel free to go to the next slide. Or actually, maybe 2 slides. Okay, so I'm going to attempt to talk briefly because I think you probably really want to hear from Cash today. But I'm going to go first and just talk a little bit about, if you're not familiar with BJA, who we are, some of the funding opportunities that hopefully align with some of the work that you all are planning or have underway. I'm going to do a high-level overview of some training and technical assistance opportunities. I think when we hold questions until both Cash and I have gotten through our presentation, so you can ask whatever you want. Then I will hand things over to him to take a deeper dive into some very focused jail and other corrections training and technical assistance. Next slide. No, actually, if you want to go to skip on to the next. So let me just do a very quick overview of where BJA sits within the Department of Justice in case you've not heard of us. So what is the Office of Justice Programs? We are largely a grant-making, training, and technical assistance arm of the Department of Justice. OJP is one of 3 grant-making components. So you may have heard of the Office of Violence Against Women or the Office of Community-Oriented Policing Services. And then within BJA, there are a number of different components, or within OJP, there are a number of different components. BJA is one of those grant-making agencies, along with our sister agencies from the Bureau of Justice Statistics, the National Institute of Justice, the Office for Victims of Crime, the Office of Juvenile Justice and Delinquency Prevention, and the SMART Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking. Next slide. So what does BJA do? There you can see our mission as well as the name of our fabulous director, Carlton Moore. So BJA strengthens the nation's criminal justice system and helps America's state, local, and tribal jurisdictions reduce and prevent crime, reduce recidivism, and promote a fair and safe criminal justice system. We focus our programmatic and policy efforts on providing a wide range of resources, including training and technical assistance to law enforcement, courts, corrections, treatment and reentry, justice information sharing, and community-based partners to address chronic and emerging criminal justice challenges nationwide. Next slide, please. So how do we do this? Really, all of our work falls into one of these 3 primary buckets. Probably most familiar with funding, as we really tout ourselves as a grant-making agency. So there is a list that is a mile long of all of the different ways that BJA provides opportunities to the field through multiple grant-making opportunities. You probably know that we're in the midst of grant season. And so if that is something that you do as a part of your job, hopefully you are looking at BJA opportunities, and we'll dive into some of those. We also work really hard at sharing information. So whether that's research, whether that's training and technical assistance opportunities, whatever the field is up to, that is something that we can bottle and share with everybody else. We endeavor to do that. We also really work hard to engage with the field. So people who are doing the work, doing the good work, doing the innovative work, and also support them through training and technical assistance opportunities. We also really love to make connections from one practitioner to the next, as many of you encounter the same issues and also can share your successes. So if you'll go 2 slides, please. So I want to talk a little bit about the types of grants sort of foundationally that we offer at BJA. So the first is formula funding. Formula grants are typically awarded on a non-competitive basis, which means that everyone who is eligible may receive funding, and that the formula that is in place dictates how much each eligible jurisdiction or applicant might receive. Most frequently, that money goes to what we call state administering agencies, or the SAA. In Virginia, that is the Department of Criminal Justice Services. So you may have seen BJA or other federal funders for criminal justice funding offer opportunities through the state, or your jurisdiction may receive formula allocations directly to your locality. The other types of BJA grants that you might also be familiar with are discretionary or competitive grants. So these are the solicitations that you might see coming out this time of year on a daily or weekly basis, where applicants apply directly to BJA and compete against each other based on a scoring system to propose projects within a particular scope, depending on the solicitation, and then are awarded based on how well they score and other eligibility factors. Then awards are made directly to the applicant, and BJA then works with the applicant over the course of the award. So I want to move along to a couple of examples of formula grants. So next slide, please. The one that you might be the most familiar with if you receive these funds in your locality, or if you have applied for these types of funds from the state to come to your jurisdiction, are Edward Byrne Memorial Justice, or JAG for short, as we commonly refer to it. And there are a number of different purpose areas under which these funds might be utilized. For localities, if the money is coming directly to you, typically you can select which one of these purpose areas to request funds or to utilize your funds for. When the money comes to the state, there is typically a longer term state plan that might focus on 1, 2, several, or allow for applicants under any of these different purpose areas. So I'll just review them very quickly. Law enforcement programs, prosecution in court, crime prevention and education, one that you certainly associate with, corrections and community corrections programs, drug treatment and enforcement programs, planning, evaluation, and technology improvement, crime victim and witness initiatives, behavioral health programs, and the newest purpose area, state crisis intervention court proceedings and corrections programs. So again, these are all formula-based, but if you are applying as a locality to the state, they then might become a competitive, but you would be applying to DCJS for these funds. Next slide, please. So another opportunity that is formula-based is the Residential Substance Abuse Treatment for State Prisoners Program, or RSAT. So this enhances either state, local, or tribal government's ability to provide residential substance use treatment to both adult and juvenile populations during detention or incarceration, to initiate or continue evidence-based treatment in jails, prepare individuals for reintegration into the community, and then also assist the community throughout that reentry process. So again, this money is based on formula allocation. Next slide, please. So that is not the universe of all formula grants, but I think they're the ones that probably you all would be the most interested in knowing a little bit about. So I'm going to dive into some discretionary grants now. So the first one, and one of the biggest or largest and well-funded competitive grants that we have at BJA is the Comprehensive Opioid Stimulant and Substance Use Site-Based Program. Cash is also going to take a much deeper dive into training and technical assistance around this particular grant program, and also examples from the field of how grantees are utilizing this in the correction space. So I'm going to do more of a sort of high-level description of COSUP, because I don't like to have to spit out that long name, as you can tell, more than once. So this particular solicitation is open to states, localities, and tribal, all government entities, and then they may, in partnership with other community-based organizations or other government organizations, undertake projects that really focus no longer narrowly on opioid use disorder, but justice-involved people with substance use disorders or co-occurring substance use and mental health disorders. There's a lengthy list when the solicitation comes out, which I will tell you should be very, very soon this year. So if you're interested, keep an eye out. It should be any time now. But some of the purpose areas under which you can apply are pre or post booking alternatives to incarceration, law enforcement and first responder, overdose response, deflection and referral to treatment, recovery support services, provision of naloxone to law enforcement, first responders, and really any justice or public health or behavioral health entity. Education and prevention programs to connect law enforcement with students, and increased access to medication-assisted treatment, along with a very long list of other potential, but this definitely does include medication-assisted treatment for those who are incarcerated in local or regional jails. So I wanted to highlight that as well. Next slide, please. So the next one is improving substance use disorder treatment and recovery outcomes for adults in reentry. Wow, we like our long names. So this is part of this suite of under the Second Chance Act grant programs, which means the emphasis is providing access to treatment during incarceration and then also continuing access to that treatment, including MAT upon reentry into the community. So this is a good place to highlight how not only can eligible applicants be governmental organizations, but also for this solicitation, and we don't do this too terribly often, but for this solicitation, nonprofits, community-based organizations that are not institutions of higher education are also eligible applicants. So some examples of what can be funded here are personnel such as case managers, reentry coordinators, treatment providers, medication, including MAT and naloxone, screening and assessment, transitional or recovery housing, working with other organizations to provide in-reach into the jails, and then also to partner with organizations to provide that continuity of care and training for those in the community. Next slide, please. So I mentioned co-occurring a couple of slides ago. So this is the Justice and Mental Health Collaboration Program. So this program seeks to increase public safety by facilitating collaboration among justice, mental health, and substance use treatment entities. So the focus here is mental health, but also co-occurring. So there's a number of different types of projects. I'm just going to throw a couple of examples out here. Mental health courts or other court-based programs, prosecutor-led diversion, law enforcement deflection, mental health services during incarceration, lots and lots of ways to utilize these funds as well. And here, the eligible applicants are state, county, local, tribal, and then also public and state-controlled institutions of higher education. All right, so you can quickly attempt to take a little snap of this QR code, but you'll also get the slide decks where you can have access to this information. But this is a really helpful, and there's another one just after this as well. This is a really helpful document that quickly describes many of the different programs that BJA supports that provide some level of assistance, either focused on corrections or jails, or jails in partnership with other organizations. So this document is a really great high level if you want to share with others to sort of advertise. These are all the things that we could do. This slide has programs that support jails. The next slide is a little bit broader. And is programs that BJA has that support all things behavioral health. And we included this because while y'all are focused on what goes on in the jail and then sort of that reentry phase into the community, if the rest of the system doesn't have these sort of partnerships and opportunities, you might see some of the same folks in your jail. So this is everything from the community to law enforcement and deflection to prosecutor-led, and then also court-based programming, and then certainly inclusive of corrections. So if we can go to the next slide, please. Just want to talk a little bit about something that I don't think a lot of folks necessarily know about in the field. It's kind of our best kept, but not on purpose, secret, which is the BJA National Training and Technical Assistance Center. So this is where you can reach out to BJA through a request and say, hey, I need a little something over here. Either sort of a gap analysis for your system, providing subject matter experts for training or just general support. It also might support folks to attend identified trainings after you've identified that gap, travel for peer-to-peer site visits, and then just overall support in identifying strategies to strengthen some of your organizational operations. So I strongly encourage folks to take a look at this. And this falls to me into the category, you never know unless you ask. It's not going to get you full-blown, sizable grant money. This really is not about receiving funds so much as it is about resources. So I strongly encourage folks to take a look at that. And then I'm going to share just a couple more websites along the way here. So if we can go to the next slide. And for every one of the programs that I listed, we also support individual training and technical assistance providers, and they all have different sort of versions of websites with potentially more resources than you could ever hope to read, but there's great ways to sort of focus what you're looking for and find some great online resources. So this is the COSUP resources website. Lots of great stuff in there. You can search by corrections, jails, MAT, any topic that you like. Lots in there for you to dive into. And then on the next slide is another list of other resource centers that we support. So the National Reentry Resource Center, the RSAT Resource Center, and JMHCP's Resource Center. There's some links there as well. Tons of great information. Also where, for I believe all of them, you can request targeted training and technical assistance. So that's another thing to look out for is if you find information there and want to know more, you can request customized training and technical assistance. All right, I think we're going to skip the questions and hold those. So if we can go one more slide. So if you are the person who is either interested in what are all of the opportunities and when will they be available, or you've been tasked with, we need to find money to support what we're doing, and you want to know what those are, I recommend that you subscribe, and there's more than one way to do this. You can send your email via text and subscribe to get notifications about not just when grants are released, but a number of other resources So you know what you're getting yourself into when it comes to applying for a federal grant, both the process, resources to support the application process, but then also what is necessary for both fiscal and programmatic management. So you can subscribe there. And then next slide. Also, and it looks like we need to update our slide a little bit here, but for social media, but there's, you can follow us on Facebook, on, this says Twitter, we'll have to fix that. There's a lot of information on YouTube. The QR code gets you to a whole lot of other information and other ways to sort of stay in the loop around what solicitations, what new things are being released. Basically, the one-stop way to get all things BJA is to stay connected. So this is my email address. Feel free to reach out to me at any time with questions. If I don't know the answer, I almost always know who does know the answer, and we'll keep working until we figure out some answers for you. So again, please feel free to reach out. I'm gonna just go ahead and turn things over to Cash and his PowerPoint so we can take a deeper dive into COSUP and that training and technical assistance, which is available to you. And then we will take questions after that. Thank you.
Thank you, Michelle. Parrish, does it make sense just to have you do the slides?
Yeah, I can do them. Let me pull them up.
Thank you. Great. Well, thank you, and good morning to everybody. Thanks for staying on and listening to us as we go through this conversation. And I just want to say a special thank you to Bay Rivers Telehealth Alliance and to the Virginia Opioid Abatement Authority and Rappahannock Community College for putting on this very informative conversation today. And I know that there have been a couple of others that have happened recently. So just wanted to acknowledge the work that this team has done and recognize the work that goes into putting on these types of convening. So next slide, please. So just a quick walk through of what I'll be talking about. As Michelle alluded to, we are the training and technical assistance provider for the comprehensive opioid stimulant and substance use program, COSUP. So the goal is to really understand what the resources that are available to corrections, jails, prisons, and community supervision agencies responding to the substance use disorder crisis in a correctional setting, as there's the window of opportunity for individuals within in jails and corrections to address some of the substance use disorder issues that the communities are facing. So I'm just going to dive into it right now, so we can go to the next slide, please. And so just a little bit of background about me and why I am speaking with you today. Prior to coming to Rulo Strategies, I spent 10 years with basically in the field, right? I spent 10 years working on medication-assisted treatment programs, using data and research to implement programs. So my job was to work with jails, corrections, healthcare staff, administrative staff, all the way up to leadership to implement these programs that truly are working to make a difference in the communities and reduce both public safety outcomes and improve public health outcomes. So just a little bit of background about me on that and why I'm speaking with you today. Okay. We can keep going. And so just a couple of items to discuss today are specifically towards the areas that we can address using COSUP funds, COSUP resources, and then specifically training and technical assistance provided by Rulo. So I want to focus specifically on, if we go to the next slide, on 4 of these items: programming, medication-assisted treatment, peer recovery support, and reentry support. Those are the major aspect that I want to focus on today, but as you saw from the previous slide, there are a number of other opportunities that we can work through as you begin to think about applying for COSIP dollars and then accessing training and technical assistance. But I do want to say at the outset, you do not need to be a grantee to receive training and technical assistance. And I think that's really important to state, because I don't want folks who are on this call listening to this conversation to say, well, I'm not a grantee, so I can't access the training and technical assistance. No, you can absolutely reach out to us. It's no cost training and technical assistance. So just want to be mindful of that. Don't be turned off by the fact that I refer to grantees or I refer to individuals who've received awards. And so expanding access to programming, I think this is an important piece of what jails are looking to do around the country, right? It's not just necessarily medication. It's not just one individual silver bullet solution to the problem of substance use disorder, right? I think programming, wraparound services are really incredibly important in not only preparing the individual while they are incarcerated, but after their release. So expanding access to programming allows for COSIP dollars to be specifically used to bring in innovative, creative, data-driven, research, evidence-based programs, and then the supplies that are associated with those programs. And what those programs could be a litany of things, you know, counseling, cognitive behavioral therapies, things that have shown to be helpful behind the walls as folks are preparing to leave, are preparing for reentry, because as we all know, a majority of the individuals that are incarcerated are eventually going to return to their communities. So our goal is to ensure that those people that are returning to the communities are returning better than they were when they came in. So, and then the next one that I want to speak about specifically is the medication-assisted treatment. I know there's a lot of conversations about medication-assisted treatment. There's a lot of opinions about medication-assisted treatment. And so there are jails and prisons around the country that are really starting to have these conversations about MAT in their facilities. Some folks have been doing it for a while. Some folks are just really stepping their toe into this world. During my time in the field, medication-assisted treatment was something that was innovative, but it was also scary, right? Folks were really only starting to touch the surface on what medication-assisted treatment was, how it works, how to implement it to prevent diversion, try to prevent negative outcomes while also utilizing it in its best forms. And so this is one particular opportunity that RULO can help in that process by working through the staffing that's necessary, working through some of the licensure processes that are necessary to get a medication-assisted treatment program implemented into your particular facilities, but also really thinking through how to find creative solutions to some of those challenges that are associated with medication-assisted treatment, right? Where I come from, a well-run facility is one that does not have diversion or doesn't have, you know, challenges and issues that start from these types of programs. So, you know, our goal is to really connect individuals from leadership all the way down to correction staff to better understand what medication-assisted treatment is, to break down the stigmas that are associated with medication-assisted treatment, and then try and implement that in its best form. So, as I was saying to you, the examples of services that can be funded through COSIP dollars, and then obviously utilizing our training and technical assistance on that is hiring staff to help facilitate medication-assisted treatment, the technology that's necessary that not only monitors the medication, but also helps track outcomes. It also, you know, utilizes different ways of doing case management for those individuals that are on medication-assisted treatment. You know, there's the funding for staff and transportation to take individuals to offsite for dosing. Now, depending on the program that you have in your facility, it is going to take some creative solutions to dose individuals on medication-assisted treatment, especially for the you know, agonist therapies. So some of the things that we can help think through with you all is those staffing and transportation costs, and then the medications themselves. You know, if you are going with the oral daily medications, there are a little less expensive, but you're doing more of those every day. Whereas there's also the injectable options, which are weekly or monthly options. Those are at a higher cost, but then there's trade-offs, right? There's trade-offs in the form of having to monitor individuals on a daily basis, having to connect with individuals on a daily basis, think through diversion issues if there are any, versus the monthly medications, which are a little bit pricier, but at the same time, it's once a month. So the cost of staff and oversight may be mitigated in some ways. So we can go to the next slide. So I just wanted to give you a couple of highlights of grantees that have started MAT programs using COSIP dollars. So this is Reno County, Kansas. It's a smaller, more rural facility, and they developed an MAT program. They incorporated cognitive behavioral therapies or treatments that also included recovery planning. That planning starts essentially with inReach. So community healthcare providers are reaching into these facilities, into Reno County's facilities, having the conversations, making those warm connections inside the facility prior to the individual leaving, and then having that same individual potentially receive them on the outside. So there is that familiar face that is connecting them with the healthcare that they need on the outside. And so it's not a shock, it's not a scary thing for an individual who's returning into the community after incarceration, especially somebody with substance use disorder and somebody with a potential co-occurring mental health or behavioral health challenge, to go somewhere where they don't feel welcome. It's a scary time. And then of course there's that support that that's provided by individuals to help find housing. Housing is one of the biggest challenges, and I think most communities can agree that housing, regardless of your current situation, is a very challenging thing during this time. And so the reentry process and finding beds and sober housing can be very difficult. So having a program that incorporates all of these different facets as part of the reentry plan has been very beneficial to Reno County, Kansas. And there's a number of other facilities around the country that have used this model. And I wanted to add a second example to this particular conversation about medication-assisted treatment. And the reason being, this is Essex County, Massachusetts. And the reason being is that there's different ways to implement medication-assisted treatment, right? There are ways in which you can contract with an external entity that you bring into your facility, and they do all of the work. They do the bulk of the medication delivery. They do, the hiring, the staffing, so on and so forth. That's one model. It transfers a lot of the responsibilities to that external party, and then you just have the oversight that's provided by maybe the health services administrator or somebody to that effect. The other way to do it is the way that Essex County, Massachusetts has done it. And there's a couple of examples of this as well, in which the facility themselves or the sheriff's office or the department themselves decides to become an opioid treatment program. So there's a specific licensure process that happens both from a state level and also on a federal level to become an opioid treatment provider in a program. And it allows you to dispense treatment medications without these external contracts. So you maintain a lot of that control, you maintain a lot of that, that ability to change and adjust your program without those external folks. Now, it also comes with challenges, right? You also have to hire your own staff, and you also have to have all of the requirements of the licensure process in place. So I thought this was a good example of showing the attendees today the two ways to do it, where you can contract with an outside vendor and they bear a lot of the responsibilities and burdens, or you can maintain control and hire the staff that fit the needs of your program, your community, and your specific challenges. So I'm curious to know how other folks, take this information, how they choose to run with it in the future. I think there are pros and cons to both of those. We can discuss those a little bit further. So moving away from the medication assisted treatment side, I do want to talk a little bit about the peer recovery support aspect. A lot of individuals, agencies, and facilities that start their own substance use disorder treatment programmings choose to incorporate peers into their programming. What are peers? Peers are individuals who are specifically trained and have specific licenses to be able to provide that connection, that rapport building that takes place prior to release, during that reentry time, and then after release, so that there is a network of support that's available to individuals that are in the community. So I think what happens is, and one of the best ways that I learned about this concept is the social network. And the social network originally being, the family, the friends, the individuals in this individual's life that posed some not so desirable attributes, right? And provided not so desirable connections. What the peer recovery support model essentially does is it turns that social network on its head. And it says all of those things that maybe weren't so positive and pro-social, let's try to find individuals and embed them in your life that are more positive, that provide those pro-social networks in your life. This is the first individual, if you have a peer support network, this is the first individual you call with good news. This is the first individual you call when you're graduating or you find a job or something to that effect, that those positive social attributes that may not have existed in this person's life prior to meeting the peer recovery support person. So I wanted to highlight Grays Harbor County in Washington State, another small rural community about 2 hours outside of Seattle. And the reason I specifically chose them, again, they are a grantee, but I want to reiterate, you do not have to be a grantee. I just highlight these folks because I think they're very interesting, regardless of their grantee status. Grays Harbor, Washington has a contract, so they do it a little bit differently. They have more of a hybrid model in which they take their own staff, their own healthcare staff, their own correction staff, but then they contract with a vendor that specifically brings peers into their facility to provide that social network, that support. So the individuals that they have chosen to embed into their facility as peers are individuals that have graduated from a drug court program. They're individuals with both a history of incarceration and also a history of substance use. Now, this is important. I know that there are probably some attendees on this conversation or on this call today that are thinking, well, I wouldn't want that. I wouldn't want individuals that have a history of substance use or a history of incarceration in my facilities. I will challenge that a little bit by saying that the individuals that connect most with somebody who is currently suffering from substance use disorder, somebody who's been there, who's experienced it, and has come out on the other side. And I'm not advocating that you use individuals that are immediately out of incarceration or immediately, still working through substance use challenges. What I'm saying is that really open up the spectrum of individuals that you are willing to work with and truly think about from a case by case basis. who those individuals are and why they may be a better fit for your program. And so Grays Harbor has done a really great job of incorporating these folks. And in conversations that I had with incarcerated individuals, I've repeatedly heard the same story. The facility that they are currently incarcerated in, is the most helpful facility that they've ever been incarcerated at. I know it's kind of a strange dynamic there, right? But ultimately, with the goal of not having folks come back into facilities, if you can provide those supports, if you can provide access to treatment, those types of conversations are actually very helpful to have, because ultimately you want individuals to not come back into the facilities, so you provide them a better experience so they're better prepared to return to the communities and stay in the communities. And then the final area that I want to talk about is the reentry support, because ultimately, no matter what type of work is going on inside your facility, no matter the great programming that's occurring, without that reentry support and without that community capacity to receive those individuals, it's not all for naught. That's not it. But it is going to be challenging for the individual. So having support, having programming that really hones in on what the individual is going to do after they release from your facility, after they return to their communities, is going to be a critical component of these particular conversations that you're having. So what does reentry support look like? Same thing, similar to the MAT side of things. It is hiring staff to help coordinate individualized case plans, treatment plans, access to employment and education services, right? Because ultimately, if we can find ways for folks to have access to education and employment, they're able to pay bills, they're able to access support, they're able to go back to school and get better jobs. But then it's not just this one size fits all. You need to have the peers that are going to help provide stability, the continuity of care that comes from communicating with the community and saying, hey, this individual is releasing from our custody. Do you have a bed for this individual? Do you have short-term or long-term, ideally, housing options that this individual can utilize? So recovery housing becomes an incredibly important piece of that. The treatment services that are available in the community, right? Community capacity to treat is going to be a very large part of this conversation, because ultimately, a lot of the work that can be done during incarceration may be undone if the community is not able to have those services in place, have those structural supports in place. So we want to continue to build up the community and the community taking on those challenges. And then of course there's the coordination with probation. Now, I find that it's important to have peers, but it's also helpful to have a probation department that's on board with the treatment plan that's in place for that particular individual, because it serves as another set of eyes and ears on this person, not in a punitive perspective, but from a supportive perspective, right? It's if probation officers are bought into the idea that this individual is going to be on medication, if that's the need, if the probation officer is bought into some of the reentry supports and the housing locations and things like that, then that probation officer is going to be more likely to help support the overall structure that's in place, as opposed to saying, hey, you slipped up once and it's time for more of a punitive action. That's always there, but ultimately the goal is to try and support this individual and have them feel like they can go and use these resources and not feel like that there is this stick over their heads at all times. And so we, the last field spotlight that I wanted to provide is St. Louis County, Minnesota, a larger county. So I wanted to kind of do a diverse look at different grantees. Another two-time grantee, actually, 2020 and 2022. St. Louis County, Minnesota is a very interesting place because they have, they're a large county, but they have some very rural areas that they also are required to service. And I think what happens is they have to be a little bit more nimble with their reentry team and their community healthcare providers. And so they've done a really good job of coordination of their treatment services, and working directly with probation officers. The probation officers have served more like recovery support specialists than they are probation officers, which is an interesting dynamic change if you really think about it. And also there are recovery support specialists that are focusing on finding meetings, and really helping folks access behavioral health, because as Michelle talked about, that co-occurrence issue is going to be a real challenge. I know in my local jurisdiction, we're talking somewhere between 94 and 97% of individuals with a substance use disorder generally have a co-occurring mental health or behavioral health challenge. So something to really think about, that it's this co-occurrence rate that's going to be a challenge for a lot of folks. And then so just closing up in the next few slides is just to talk a little bit about what training and technical assistance looks like. So you can go on to this website, and I know that this deck will be shared after the fact. So and you can access training and technical assistance. Now, depending on the request and the needs of your community, that training and technical assistance request is routed to a number of TTA providers that BJA works with. And RULO, being one of those TTA providers, typically works with jails, prisons, and community supervision agencies to help with some of these conversations about recovery and peers, medication-assisted treatment. Those are the items that we're working with. So this is just a quick, you can see my contact information on the bottom there. This is our team of TTA coordinators and coaches. These individuals all come from the field. That's the one thing that we wanted to make sure when we were building our team for this conversation or for this partnership with BJA. We wanted to make sure we had team members that were specifically from the field, folks that have worked with jails, worked with medication-assisted treatment, have worked with peers and recovery support specialists in the past, and we also have individuals that have worked with probation. So this is the team. My contact information is at the bottom there. Again, if you have any questions or want a little bit further elaboration on what I'm talking about today, please feel free to reach out. And then I just want to quickly touch on the jail-based MAT mentor site initiative. Again, another great BJA initiative that we help kind of administer, but essentially it's, if you're a jail and you're thinking about stepping your foot into this world of medication-assisted treatment, and you would like to see how someone else is doing it, if you want to learn from another facility, you can use this mentor site initiative to put together a team that has that can fly to or travel to one of the mentor sites that have been selected by BJA and see how it's being done on the ground. Because I don't think there's any better way to learn. I mean, I can sit here and talk to you about medication-assisted treatment all day, but I think ultimately when your operations folks, your healthcare staff, your leadership, your sheriffs, your wardens are thinking about these types of programs, ultimately seeing it happen live and in person, there's nothing better than that. And I think that's how you truly learn. That's how I learned about these. I went and visited sites. I went and talked to individuals. I cross-trained from leadership all the way down. And I'm truly grateful for that opportunity. And now I'm so glad to be able to help facilitate some of these conversations as well. And so currently we have 4 sites that have been approved by BJA. I'm excited to say that there are a couple of more sites coming online in the very near future. So there's a few announcements that should be coming out soon. One of them at least one of them is actually based out of Virginia. So that'll be very exciting for those folks that are pretty much everybody here on this call is in the Virginia area. So one of those sites is going to be a mentor site. So we'll announce that. But right now it's Hampden County Sheriff's Department in Massachusetts, Franklin County, so Hampden County is a large facility in central Mass. Franklin County is a small rural jail, average daily population just a few hundred, but they are also one of those sites that's an example of an opioid treatment provider or program. Then you have the Vermont Department of Corrections, which is a unified system. And then you have SCORE Jail in Washington State. So we're working on building a more diverse array of facilities as well for folks to visit, more rural, more center of the country. So those announcements should be coming soon, and I'm looking forward to hearing, where folks are interested in traveling to and seeing and learning from. And I think this last link here is, and I believe this is my last slide before we get to questions, is the link to be able to become a mentee site. So you click on the link, you go in, you fill out what it is that you're hoping to get out of a mentor site, what you want to learn, what you're hoping to incorporate as far as MAT if you are thinking about dipping your toe into that world, or if you've already started and are looking to expand. That's also really critical because some folks start somewhere and then they realize that, hey, there are different needs in their community and want to incorporate additional options. So this is the way to get access to that. The surveys that you fill out on this particular website come directly to me and my team, and then we'll reach out to you within 24 to 48 hours to set up a call, get to learn a little bit about what you all are looking to do with your MAT mentor-mentee relationship. And then we'll work with BJA to set up that conversation, to set up that meeting, and then ultimately, hopefully, a peer-to-peer exchange visit at the mentor sites facility. I believe that's my last slide. I think we can turn it over to questions at this point. And thank you all for your time. This has been great.
We thank you both, Michelle and Cash, for that time. I've learned so much myself. I can't wait to go back and listen to the recording again, just to really get it ingrained. We do have a question. Before I go to that question, I'd like to say I saw a hand come up a few minutes ago. So if you have questions, if you'll use the Q&A, then we can take each one as it comes. How do we coordinate with probation when patients are reluctant to sign a release of information form?
Well, that's a great question. And I think that the consents and the release of information is an important component of a lot of coordination. I think that working directly with the trial court, if that's who oversees probation, or working directly more specifically with the probation officer to try and ultimately, the answer is it is a voluntary. Generally speaking, medication-assisted treatment or these types of programs are voluntary, and so it is going to take coordination. It's going to take conversations between interagency conversations, but it's also going to take the individual themselves to be on board. One of the things that worked for us in my former life was working with the family members of those that are incarcerated. Now, this also takes a consent process, of course, but I think that what was helpful for us is when family members were engaged, the individual was more likely to also be engaged. So we had conversations in which moms and dads and grandparents and wives and husbands were reaching out to the individuals from our facility, family support services unit that we started, and they really worked through the best way to try and convince individuals. And the more rapport that was built prior to release, the more likely that individual was to engage post-release.
Thank you. What does the housing support in Reno County, Kansas look like? Is it only recovery housing, or does it also support other transitional housing options?
That's a great question. Both. The answer is you meet individuals, and Reno does this very well. You meet individuals where they're at. There is no one size fits all. If an individual needs recovery housing, that's where their recovery support specialist will go. If the individual needs short-term housing options, that's where the recovery support specialist will try to find it. Again, housing is one of those really challenging, really difficult to answer questions right now. But one of the great things about COSA funding is that it does provide resources for those options, but transitional, long-term, stable housing is the ultimate goal. How you get there is going to be unique for each individual person, and the number of beds and the boots on the ground work that's required to set up those community partners, those conversations, and convince folks to take individuals that are releasing from your facility. That's what gets you to where you need to go.
I wanted to add to that to talk really more broadly about COSUP and the funding. So you can use a percentage of COSUP funding in an application to fund housing. I will say typically we are talking about recovery housing because that is the nexus of COSUP is justice-involved people with substance use and co-occurring disorders. So if your question, Ivo, was more about the funding as opposed to the navigation, then COSUP really is focused on not sort of broader reentry, but reentry as part of the continuity of care, and that would mean recovery housing.
Thank you. We have another good question. Are MAT mobile units allowed under MAT services? I'm thinking of a mobile unit that would go to various facilities versus facilities having to take individuals into the community for this service.
So I will address the money part, and then Cash might want to dive into how he's seen folks do this. So BJA, COSUP funding in particular, you cannot purchase a vehicle. So notice I said purchase. It's possible to lease, but purchasing a mobile unit is not something that you could do with COSUP funds, but you could also use COSUP funds to staff it and support other aspects of the mobile unit. And we know grantees have done and are doing that. So I don't know, Cash, if you want to take just a minute or two to talk a little bit about how you've seen folks utilize mobile units in the field.
Yeah, no, that's a great question, because mobile units are a great way of solving the rural problem, I believe. When in communities in which access to healthcare is limited, and access to medication-assisted treatment is limited, mobile units are a great solution to that problem. It's also very helpful in some conversations that I've had with tribal programs that utilize mobile units to deliver medications and deliver treatment options in these communities. So I won't touch upon the buying versus leasing piece of it because Michelle is the expert, but I will say there are programs who are utilizing mobile medication assisted treatment, mobile treatment vehicles to be able to deliver treatment and care.
And the other thing I would add too is that since we're talking about a rural community where there's lots of services that ideally would be taken to the person as opposed to the person coming to the service, that we've also seen where it's a mobile unit not only for the purpose of MAT, where it might be coupled with other services. And that way it becomes more of a one-stop shop, whether it's harm reduction or behavioral health services or public health services, or I've seen some very creative things, legal services, legal aid, all kinds of things in one big bus that goes all around. So there's some complications around maybe MAT where some of that might be concerned, but I would say get creative. Other jurisdictions have been able to do that.
Thank you. A question asks, did you address ensuring inmates being released that are on MOUD Matt, are promptly followed up with community care at the time of release?
So
Yeah.
I think in terms of, I mean, the funding person, so I'll talk about that real quick, which is all of that continuity of care are things that you can support with COSUP funding from induction or continuing in the jail setting all the way to release and doing those warm handoffs to community providers. There's a lot of different ways and examples of ways that folks are doing that. And so I would defer to Cash to, that might be like a whole nother very long conversation with examples, but the funds are available to do that to ensure the continuity of care.
Yeah, and just to touch upon that quickly, I know we're probably coming up on time here, so I want to be mindful of that. But the piece that I think everyone can understand and appreciate is that the first 48 hours to 2 weeks post release are the most vulnerable time for individuals. So ensuring that they have access to community healthcare appointments, but not just, hey, here's a pamphlet, go and find it, but more so setting that appointment up and making sure that that individual has transportation to their appointment, has the ability to get there, has the ability to walk in the door and is either insured or there is some payment plan in place to ensure that those services are paid for. Um, is a critical component of this, and to as folks are leaving and having access to community care at the time of release is part of it. Should always be part of that case plan, of an individualized case plan.
Thank you. Donna, you're muted.
Thanks to Cash and Michelle for wonderful presentations. I feel like we could have given you the whole morning to cover the content that you have to offer. I actually have a question before we move on. Being a telehealth organization, Bay Rivers Telehealth Alliance is really interested in learning more about how jails are using telehealth to connect their incarcerated individuals with medication-assisted treatment and with other substance use disorder services. Do you have any examples or any feedback on how telehealth might help, especially rural, smaller facilities?
So I think you can use funds for that in order to make that happen. And what I often say to people is sometimes we get hung up on, I don't have the equipment for that. If the equipment you have is sitting in the jail and it's being, not used all the time for other things, whether it's to connect to the court, to connect to attorneys, whatever it might be, if it meets the appropriate privacy, standards, you could use it for any number of things. So I think sometimes folks think I need different equipment and a different room for everything that I do. And we know that in a smaller rural jail, that's just not possible. So I strongly encourage people to identify the technology needs sort of separate from the process needs and then work on them both at the same time. And the funding is available to support telehealth services for all the reasons, Donna, that you just said.
Anything to add, Cash?
Oh, I didn't want to. I wanted to make sure that. So the one thing that I will add is that there are quite a few examples of folks that are using telehealth and telemedicine to work with individuals. I think virtual visits are something that can be extremely beneficial to individuals. I also think that to Michelle's point, I think the technology needs coupled with the network needs, right? The internet challenges that some of the rural communities have. Those are types of creative solutions and creative thinking that needs to happen. And I think using these resources are going to be helpful in that piece of it. But I think the more important concept is process. And to Michelle's point, having a dual track conversation with with the individuals that are in your facility, that they are working towards getting the right processes in place from, intake, the moment that individual walks in the door and starts that reentry process all the way through release. How you connect with individuals either virtually or in person is going to make a big difference in the outcomes that that person sees when they release.
Thank you both very much. Yeah, one of our partners who's actually on the call this morning has a mobile van that they take to the regional facility, and they are connecting people not only with the substance abuse services in the van and all the other supporting services, but also using telehealth on the van. So it really draws the whole community of support to the facility to assist people who are incarcerated and in their reentry program. So thank you both for being here today. We're so delighted that you joined us, and I know I speak for everyone on the call and saying thank you so much. We so appreciate you, and I'll just wrap up here with a few ideas on collaborative grant making.
Thank you so much for having us. I should have said this at the outset, but I live in Virginia myself. And so it's really great to be able to come and chat with all of you and make sure that you know about all the opportunities for grant funding and training and technical assistance that are available to you. So thank you for having us.
Thank you, Donna. Appreciate it.
Well, I'm going to just share a few slides to talk about collaborative grant making, because so much of what we've talked about today is related to working with partners. And that's something that Bay Rivers Telehealth Alliance has had a great deal of experience on, and just the process for that, some tips about that. We're also working with the Mid-Atlantic Telehealth Resource Center to develop impact assessment for correctional institutions. It's kind of a late new development. So if you all have interest in having an impact assessment, taking a look at how you can use telehealth in your programming, or would like some additional support with developing grants, Bay Rivers Telehealth Alliance is available to do that. Next slide. So this is a grant resource development schematic that I like to put out front, because grant development is so much more than writing an application. Finding those potential funders and setting up your organizational filing and record keeping systems to support grant management is so essential, and it shows up in the application if you have those systems in place. Identifying good funding prospects, good matches, the program components and needed partners for your grant, and establishing a proposal development calendar is an essential next step. And then you have to match the funder to the programs you want funded. You may have a whole collection of things you want to fund, but developing those model proposals that can then be adjusted and assembled and put together to address the interests and the requirements of potential funders is an important aspect of being successful. So pulling together this block that says assemble and train the grant team to tailor proposals, to develop proposals, is so essential. Having the right people at the table, the right partners, and then when you submit the application, it's so much more than just sending in an application. I was delighted to hear the Virginia Opioid Abatement Authority talking about reviewing draft proposals, getting feedback, really helping out before you ever submit the application. So it's about providing updates, developing a relationship with funders, communicating your progress, reporting, so essential, and then renewing funding if that's an option. We can collaborate with our funders and give them information about what's actually happening out in the field. So strategizing together is an important part of that relationship. Next slide. So coordinating with members, partners, and stakeholders to review the NOFO carefully for, are we eligible, who's eligible to apply, and who can take on the other roles essential in delivering services, meeting the requirements. And if there's a pre-proposal workshop available, being sure to attend it, maybe even having a few people attend it who might have questions from a different point of view. It helps to create a summary of the notice of funding award, and I'm using the different language, request for proposal. Different funders have different ways of talking about that piece of paper that describes everything they want you to include in your application. But creating a summary and boiling it down, circulating it to the potential partners, and then having a one-to-one communication about how those partners might meet the needs of the system you're trying to support. You can form a grant development team with appropriate representatives of the partner organization, and then from there determine if additional partners are needed, and if your partners have contacts in the additional partnerships that are needed. It always helps to have a warm connection. Create a working application summary document. This allows you to communicate with stakeholders. In some grants, you need to ask for buy-in and even letters of support, for example, from the State Department of Corrections or other organizations. In our work, we very often need to inform and ask for support from the State Office of Rural Health. So developing that summary of partner roles and related budget information helps you communicate not just with your partners, but with other stakeholders, your county administrators, your state representatives, and various stakeholders who are interested in your work and might even write you a letter of support. Very often, our funders want to have a draft letter of commitment or memorandum of understanding in the application. So having that established early on in the process of developing your proposal is an important step in clarifying the expectations, the roles, and responsibilities of your partners. Next step. So really, there's 3 phases to this grant application timetable. Preparing for the funding opportunities. It's not too early to start preparing now for the next grant application cycle that opens up in the fall for the Virginia Opioid Abatement Authority, or even next year's grant. If you find this year, one of the BJA grants, we can't quite get it together to provide an application for this year's deadline. Starting ahead of time to gather the ideas and community input for the priorities you would like to have funding, and creating a logic model. If we do this, then that will result in this, and ultimately our outcome is to get people who are free of substance use and can sustain their recovery, not only when they're incarcerated, but upon release and for the long term. So creating that logic model really helps you to identify the evidence-based and informed practices that you need to be providing while people are in your facility. Collecting demographic data for your regional target populations is essential to be able to describe who you're going to serve in depth and what their needs are, and to demonstrate to your funder that you know who you're trying to serve and some of the barriers they encounter, some of the cultural competencies you need to have in order to be successful in delivering your program. I already mentioned the importance of building relationships with potential partners and stakeholders, and might I add, even the funders you're going to be applying to. It helps to subscribe to relevant grant notifications and mailing lists, and we've had a lot of great connections here on today's webinar, mailing lists to subscribe to and get on that information about where is good funding. It's not just government funding, but also there are private foundations, state funding, local funding, and community foundations that can and are interested in supporting your efforts. Phase 2 is really that active phase of preparing the application. 4 weeks, ooh, that's tough. You probably need a little minimum 4 to 6 weeks to really thoroughly review the NOFO, the RFP, schedule the partner meetings, discuss your strategy, make sure you're all on the same page, draft the narrative, the work plan, the budget and attachments, and contact the project officer with any questions that you may have. Takes a little time to turn that around. Gathering partner letters, letters of support, additional information and backup for your evidence-based practices or your gold standard practices, as the Opioid Abatement Authority talked about, and finalizing the content, having a proofreader review the application or two, and then submitting the application. Most of our applications are submitted online these days. And if you're like me, some days the internet goes out, some days your computer freezes up. So allow for 3 days before the deadline to submit that application. And finally, in phase 3, that's the award phase. It takes some time, sometimes anywhere from 2 to 6 months or more for the award announcement. Did we get the grant we worked so hard for? But during this time is an important time to continue the conversation with your partners. Many people who are committed to this want to keep talking about it. They don't want it just to go away. And they also want to find other sources, other possible sources of funding. You've started something here. Don't let it fall away as you wait to hear back about this one grant. Negotiating the final terms of the grant agreement may take some time. Several of our funders, if we start spending the money, that means we've accepted the grant agreement. There's really not a lot of negotiating. So really being careful to share the final terms of the grant and the notice of awards with all your partners so that they are willing to comply with the requirements. And we suggest convening a project team or advisory council to begin implementation immediately, if not before the grant is awarded. It's never about just getting a grant. It's about developing a grant resource development program. So you can bring in several sources of funding and braid them together to support all that you want to do. For example, if one of your funders doesn't support purchasing a vehicle and you really want to purchase that vehicle, you can find another funder who might be willing to fund the purchase of that vehicle. So it's important to continue that process of communication. Next slide. Key players on your grant staff team, your grant development team, and your grant partners. I make this distinction because there's always that core group of staff who are doing the work of putting words on, putting words down, compiling documents, putting together a timeline, keeping track of the page count, assisting in designing the program and writing the proposal. But the partners, the partners are the organizations needed to fulfill the project or mission priority. We pull together a grant development team to envision what is each partner going to do? Who do we need to bring to the table to have this conversation about how is it all going to work? And key staff members who are writing the grant need to be at that table. And sometimes they are not the subject experts. You need the subject experts at the table to talk through the process of how things are going to work so that can be then put into writing. It's important that our stakeholders, our individuals and organizations who have a stake in seeing these activities work, like the Department of Corrections, legislators, county leadership, are kept informed about what we're planning. And then, of course, identifying the applicant who will take the lead in writing the grant and applying for funding. In today's presentations, we've heard different funding sources have different requirements. We're working with a institution of higher education that also happens to be a state-funded organization. There's some funding opportunities they can apply for and some that they can't. So identifying who will take the lead in writing the grant, applying for the funding, and then what the roles are of everybody involved. Next slide, please. So defining your purpose, it seems pretty straightforward, right? But when we really look at it, knowing who we are is not just about knowing who our organization is, but also knowing who the other partners' organizations are. And how do we come into alignment with a common purpose for this particular funding opportunity? Or thinking more broadly, to develop a coalition that's going to focus on reentry programs or even the full life cycle of pre-incarceration, incarceration, and then post-release, so that we have a sense of what are we doing here? What are we trying to fund? And very often the funders are looking for you to answer these questions in your application. So that's actually why Bay Rivers Telehealth Alliance was formed, so that we had an established coalition where we know each other's vision and mission, our history, principal guidelines and goals that our organizations have, and what are we really reaching to achieve for our communities and the people we serve. So defining our purpose is an important step in not just building a coalition, but applying for every single grant you apply for, whether it's establishing a new program, working to enhance and expand an existing program, improving the quality of service delivery, introducing a new evidence-based practice that maybe we weren't aware of when we first developed this program, or expanding outreach. You may just want to get more materials, supplies, and equipment or prepare your workforce. But even if it's all about paying for equipment, adding staffing positions, you have to know everything up above every single one of those bullets to make a compelling case for funding. Next slide. So I think a big part of this collaborative grant making is really listening and asking questions of our partners, our stakeholders, our funders. What do we hope to accomplish with this proposal? What is the significance of the problem in our community? And why is it critical to address this problem now instead of 10 years down the line, or 5 years down, or next year? What documented proof or evidence is available to support the need for the project and the methods that we're proposing? Whom will the project serve? What plans, studies, data are available to identify and quantify the need? How will the defined population be affected? And maybe we can learn something about that. None of us are future predictors, but we can learn about that from other people who are implementing similar methods. And how do we know if our solution will work? We hope it's going to work, but we can start to document that. And these are the kinds of conversations you need to have with your partners. Next slide. Developing the work plan. Every different funder seems to have different ways of asking you to define your work plan. They may want goals, strategies, objectives, activities, and outcomes, or maybe they only want to hear one of those, and then who's responsible and what's your timeline. So just understanding the language. It's a lot like, I often say, writing a grant is a lot like following a recipe in a cookbook. You need to know the language. When they ask for a pinch of salt, you need to know that that means this much, not half a cup. So learning what the difference is between outcomes and outputs, understanding what does the funder mean when they're asking you to describe your activities. Perhaps they're actually thinking they want to know your goals and objectives and what kind of strategies you're going to use. but the way they have it defined on their work plan is activities. So developing the work plan is kind of the framework for what you're going to do, how you're going to do it, and your timeframes. And then putting all the pieces together. I've listed the grant components that we see in many grants, but as I said, each one's different, and some may not ask for all of these, but some of them will ask for even more than what's here. So follow the directions, and step by step, we usually say have a heading for every question the funder is asking, so you don't have to make them search for where did they answer that question in your application. Next. So here's the list of helpful resources that I use, that I go to for developing funding. And you can find these links in, we have put together a resource page, which includes all kinds of links from all of our presenters throughout the series. And of course, feel free to contact me if you have any questions about pulling together applications, telehealth, and how you might use that. And I think the last slide includes my contact information. Oh, here's a little bit more information about our resource sheet. You can review the recordings of all 3 of our sessions, as well as see the slides of our presenters and our resource sheet on this link. And we have an extensive directory of links to toolkits, articles, publicity from our presenters, and information directories that can be found there as well. And then I've also included the links for the Virginia Opioid Abatement Authority and the COSAP Resources program here on the slide. Before I stop and take questions, I did want to share one other, share the resource sheet that we've put together that I think will be helpful to you all. And again, this is also on our webinar. But I'll just show you just how extensive it is. Can you see that okay?
Yep, we can see it.
Okay. Sorry for the scrolling. I hope it doesn't make anybody dizzy, but there are 6 pages of resources here. Toolkits and guidelines for establishing medication-assisted treatment and other substance use programs. We have related articles, data resources, frameworks for related information, prescriber guides, and then we get into some of the links that our presenters have offered. Our first presenter, Steve Gordon, gave us a number of links related to the settlements and the work of enforcing the ADA for implementing MAP programs. We have Chesterfield County was our presenter in session 1. They gave us a number of different links about their program, which includes both publicity and their resource pages. If you were on that presentation, you may have seen their QR codes. These are the links. And then Fairfax County presented on day 2 about their STAR recovery program, and they've had a lot of publicity. So there's a lot of links here from interviews and on their website. So you can find a lot of wonderful information here. And I just recently watched this YouTube video that all the jail staff at Fairfax County are required to watch. It's the addiction neuroscience. It's just a really fascinating stigma busting video on medication for addiction treatment and other media. And then finally, we have our section on funding links, more information on potential funding sources, as well as technical assistance and resources. I have been updating this every week, and we keep getting more and more resources. So there's a lot of great information here. And finally, on the bottom, this link for where you can get all these webinar materials. So with that, I want to thank you all for being here. And if there are any questions, let's see if we have any questions for this section, but I'd be happy to take any questions if you have any.
Yeah, I don't see anything quite yet.
Okay.
Your questions in the Q&A.
Well, while we're waiting for questions, I did want to remind you about some of the other resources that are available and encourage you to visit our website. It may take us a day or so to get the recording up from today's presentations, but we are updating that resource page regularly. We're hoping to identify a way to continue to update that. We've contacted the folks at VCU who are working on developing a resource toolkit through the Virginia Opioid Abatement Authority to work closely with them to provide these resources. So there's a lot of information and support out there. Also want to encourage you to contact us at Bay Rivers Telehealth Alliance if you have any interest in receiving some support for grant development or telehealth activities in implementing your programs. And finally, let you know that we're going to put a link in the chat for a final feedback evaluation related to this workshop series. We would love to keep providing you webinars that you have an interest in. So please let us know your interests in hearing more about providing effective substance use disorder treatment and programs in correctional facilities and reentry programs. We're very excited to be participating in some efforts in our region to develop and support reentry programs. Okay, so if there are no more questions, I'd like to take a moment to thank our speakers again, our wonderful speakers who took time out of their busy schedules. I'll remove my pin so you can see them again. And thank especially Marlene Crawley and Paris Nelson from Rappahannock Community College for all their support, and Darlene Randall McCoy from the Bay Rivers Telehealth Alliance, and the Executive Director of Bay Rivers Telehealth Alliance, Mary Oxner, who has supported this program and its development for over a year. Delighted to spend time with you. Thank you so much for participating in this webinar series. And if there's no more questions or comments, we'll give you back 10 minutes of your life. Maybe have a little extended lunch break. And thank you again for everyone being here and participating in today's training.
Thank you, Donna.
Yeah, thank you.
Ash, really appreciate you. And you too, Marlene and Paris.
Thanks.
Thank you for all your support. You have been instrumental in making this happen.
Really enjoyed the partnerships.